Hello, welcome people. In the exam, they can ask chemoprophylaxis of HIV infections. Okay, chemoprophylaxis of HIV infections. Now, HIV is what? It's a retrovirus. So, it will have reverse transcriptase, that is RNA-dependent DNA polymerase. It will make from the RNA, it will make the DNA, and then it will again make mRNA, etc., etc., and synthesize proteins and survive. So it has RNA and then it becomes DNA. Now how exactly it affects our body? It will decrease the number of CD4 cells, that is helper T cells. Now these will decrease our immunity, correct? Cell mediated immunity, and helper cells are also required for humoral immunity, correct? So definitely all types of immunity will reduce. So the person will become prone to infections like TB, Kaposi, sarcoma, lymphoid malignancy, etc. So this much you know, guys. Just a small introduction was given to you. What are the objectives of antiretroviral therapy? You want to suppress HIV replication. You want to suppress this virus. You want to improve the immune. You want to prevent drug resistance, and you want to prevent the opportunistic infections like TB, etc. So objectives are pretty clear. Are the objectives clear, baby? Yes, they are clear. We want to suppress the virus, we want to increase the immunity, we want to prevent drug resistance, and also we want to prevent opportunistic infections. Very good, very good. The principles of antiretroviral therapy for HIV, you want to achieve these objectives, you want to combine the drugs so that you get a synergistic effect and you can prevent the drug resistance. Now let us look at the first line. Drugs. The first line drugs are usually like NRTI plus NNRTI, that is 2 NRTIs plus 1 NNRTI, guys. So just look at this table. Do you remember the NRTI and NNRTI? In NRTI, Tenofovir is most important. The first one they are mentioning is Tenofovir, TDF. Tenofovir, give it with lamivudine plus last one in the regimen, in the 3 combination, the last one is EFV-RENS, okay, that's NNRTI. So, Tenofovir, middle something will be there, then EFV-RENS, okay, this diagram now. Tenofovir plus lamivudine plus EFV-RENS, Tenofovir plus Emtricitabine plus EFV-RENS, okay. First line antiretroviral drug regimens in adults and adolescents. At the bottom they have written something for pregnant and breastfeeding women as well. Okay, if it is marked with this some mark, then you can give it to pregnant women also. Wait. Send this back. Look at this one. Zidovudine. Again, Tenofovir only is there. Lamivudine, Emtricitabine only. Middle one always Lamivudine, Emtricitabine only. Here instead of Tenofovir, Zidovudine is there. In the end they have changed some things. EFV-RENS, Nevirapine. Nevirapine has become a good choice here. What is Nevirapine? Nevirapine is a NNRTI. Last, instead of EFV-RENS, there is Nevirapine. What is this Dolutegravir? Dolutegravir, they are saying don't give in pregnant and breastfeeding women. They have not marked it with pound. So it's Dolutegravir. Where is this Dolutegravir? Oh, here, integrase inhibitor. Anyways, guys, this Dolutegravir combination, they have not recommended for pregnant and breastfeeding women. So, first line antiretroviral regimens for adults and adolescents are complete. We have completed. Moving on.